I'm Lindsey Hueer. I'm one of the government relations advocates with AWC. I handle public safety, criminal justice, behavioral health, and human services, but a number of other issues. And one of the issues I have the privilege of getting to handle is the co-responders. This is a new innovative program that cities are adopting. It's been around for about 40 plus years, but it's really taken off in the last 5 to 10 years and provides kind of a fourth leg of the first response stool to be able to provide a response on the behavioral health crises, really recognizing that it needs a special behavioral health trained professional above and beyond what our usual fire, EMS, and law enforcement provide. So it's a great program that's responding to the growing behavioral health needs in our community and provides them with the de-escalation, the crisis services, and then the attachment to those services to hopefully provide the care for an individual who's going through a behavioral health crisis.
I'm Councilmember Neil Black of the City of Kirkland, here today on behalf of the City of Kirkland in support of 2245. I'm also Kirkland's representative on the Principals Assembly for the Regional Crisis Response Agency in North King County. Building on the work that the state has done to establish the 988 Behavioral Health Hotline, Kirkland has been partnering for years with our neighboring North King County cities in providing mobile crisis response services, and recently to cite the first 24/7 No Wrong Door crisis clinic on the east side. Without this full continuum of care in place, our community members experiencing a behavioral health crisis fill emergency rooms and jails where stabilization and linkages to follow-up wraparound care is remote. As Kirkland and others around the state start to expand their work in this space, the demand for qualified and well-trained behavioral health system workers will only increase, which is why Kirkland is supportive of the fact that this legislation doesn't just embed behavioral health responders within the public safety and first response system, but also expands the workforce development in this field, ensuring our responders are trained and prepared for a long-term career.
I think that there's a recognition that behavioral health crises really need a special type of response, and they need a designated professional who's trained in behavioral health crises to be able to respond to those situations, to de-escalate those situations, and then provide the services that that individual will need in order to de-escalate out of that crisis. And that's what these co-responder programs do. They're embedded within law enforcement, they're embedded within fire, within EMS, they're partners with other cities, with other counties, they're partners with nonprofit community providers in the community, so they look a little bit different from one community to the next, but really meeting the needs that are on the ground in that community.
My name is Brooke Bittner. I'm the executive director of the Regional Crisis Response Agency that is formed by an interlocal agreement between the cities of Shoreline, Lake Forest Park, Bothell, Kenmore, and Kirkland, and was one of the entities that WCIA was referring to, that is cities doing the work of alternative response within our public safety and 911 system. And I'm here today to support this legislation to create more space for our city and other cities to engage in alternative response work. With the RACER program, Regional Crisis Response Agency, we've seen incredible outcomes in our cities. We are deploying mental health first responders through the 911 system with our law enforcement and firefighters to people in acute behavioral health crisis. And our cities were brave and stepped into this space in the early days, but to allow other cities and municipalities and counties to engage in this work within the public safety system, it's important to have adequate liability protections.
I think because of the success of these programs and because there's such bipartisan support to say we need to have a really robust system to respond to the behavioral health crises, we're seeing a lot of legislative interest in this issue generally. A number of issues across the entire behavioral health spectrum, from funding workforce, from making sure that we have adequate treatment capacity, that's both building the capital infrastructure and then making sure that we have those operational expenses. All of these things are part of a larger conversation. But in terms of co-response specifically, we have two legislative priorities. There's the first, that's House Bill 2088. This would provide really necessary liability protection for co-responders. In the same way that we have liability protection for police, we have liability protection for fire, for EMS, we need to make sure that we have that liability protection. So often as we're talking to city officials about starting or expanding a co-responder program, they ask us, how do I fund this? And what about the liability? So this is really a question that's on cities' minds because these situations are volatile and they are challenging. And so making sure that we're not unnecessarily protecting, but that we are providing the protections necessary so that cities can engage in this space.
My name is Kim Hendrickson, and I'm the Director of Housing, Health, and Human Services for the City of Poulsbo. I'm here to speak in strong support of HB 2088. Our little city of Poulsbo has been a very important leader in the co-response movement in Washington State. We've been pairing mental health professionals, substance use disorder professionals, and people with lived experience with our firefighters, EMTs, and police officers for the last several years. We know from experience here in Poulsbo that hundreds of thousands of people in our state are using 911 to address their behavioral health related needs. Here in Poulsbo, we're very proud of the fact that the response to those 911 calls often involves a social worker, a peer, or a substance use disorder professional. I have personally now set up 3 co-response programs for our city. So I can tell you from personal experience that one of the biggest obstacles to both starting and sustaining these programs has to do with liability risk. There is a great deal of uncertainty about what's covered and what's not covered for our field responders. And as you all know on the committee, where there is uncertainty, there's a great deal of discomfort. I urge the committee to support HB 2088 to help cities like mine operate field response programs to better serve their residents and to give clear, common sense protections to the remarkable behavioral health professionals that are out there in the field helping people in crisis every day. Thank you so much.
The other bill is House Bill 2455, and this bill would provide some training and certification through the University of Washington. Importantly, it would also provide grants for small and rural agencies to be able to send their staff to this training. These are new and innovative programs. Even though they've been around for a while, we don't have a standardized training curriculum for them. And so being able to provide that training to make sure that our folks are out there and doing the work as trained professionals is really important. We're advocating for that bill this session.
I am John Ehrenfeld, the Mobile Integrated Health Program Manager for the Seattle Fire Department, and here today representing the Washington Metro Fire Chiefs, as well as the board member for the Co-Responder Outreach Alliance of Washington. Thank you for your time today. I'd like to speak in support of HB 2245. Co-response is a critical element of the 911 response milieu in Seattle. Our Health One program has attracted national recognition and shown the value of co-response in the fields of crisis intervention, outreach to underserved populations, and avoiding unneeded hospitalizations. Every day we witness the gaps in the behavioral health system that we believe first response and co-response can help address. In Seattle, our program builds on the trust and skill of our firefighters and their widespread support in the community, paired with expert case managers who are skilled crisis responders and system navigators. However, we need more standardized training, streamlining, and professionalization. This would add to the credibility of co-response and its professionalization as an emerging field in 911. As Representative Bronowski mentioned, there are substantial training gaps, particularly for frontline first responders, that this bill can help address, and I believe that co-response can help lead the way. The work done under HB 2245 can additionally have a ripple effect and can support the training and development of civilian mobile crisis teams, community-based teams, and others. Thank you in advance for your support of this critical bill.
I am Cassie Hallstone, co-manager for the HOPE team with the Tacoma Fire Department, here today representing Tacoma Fire Department in support of House Bill 2245. The HOPE team is an alternative response program that is dispatched via 911 in tandem with law enforcement, fire, and EMS in Tacoma to more specifically address the complex needs of individuals in acute behavioral health, mental health, or substance use crisis. Our program's been active since September 6, 2023, and our first 147 calls with law enforcement and fire, we were able to divert 16% from emergency departments and jails with alternative resources. So House Bill 2245 has clear goals to continue to refine co-response programming in many ways that will be incredibly influential, and I believe that the proposed standardization of co-responders across the state in House Bill 2245 will allow for the inclusion of first responders and other professionals working within that system of care. Additionally, it creates an opportunity to develop training programs for implementation of best practice for co-response, which could lead to further credentials and licensures and address the needs for the development and implementation of additional peer support programming. And lastly, it addresses the need to integrate 988 and 911 systems to increase care provision.
Yeah, so to learn more, stay involved. Always we encourage our members to do that. We send out our weekly bulletin. We also have Friday weekly calls that applies to the co-responder issues and all of the issues that AWC manages. And then if you have a co-responder program, reach out to us. We'll get you connected with all of the resources and programming that we have for this, opportunities to testify on these bills, and definitely want to hear what's going on in their communities and how we can best help.